In this torso, you can see here is the abdomen, here is the thorax, and you can see the heart, and from the heart you can see aorta, ascending aorta, descending aorta. Then you can see diaphragm, the descending aorta, passing through this aortic hiatus, and you can see here the abdominal aorta. Here is the abdominal aorta on the posterior surface of the abdomen. When abdominal aorta gets to the lumbar 4, it divides into two divisions. You see here in the right and left common iliac. They are called right and left common iliac. At the level of the L5, each common iliac branching into two parts. You see here is the external iliac, here is the internal iliac. On the right side and the left side, external iliac and internal iliac. As you see, internal iliac, as its name suggests, they enters to the pelvis and supply blood to the internal organ of the pelvis. But the external iliac passes underneath the inguinal ligament and goes down and supply blood to the lower limb that I will show you here. Again, here is the common iliac. It divides into two divisions, internal iliac and external iliac. And here is the inguinal ligaments. External iliac passing through underneath this inguinal ligament, passing underneath the inguinal ligament, and its name changes after passing underneath the inguinal ligament. You know, it's the same tube of blood. It's the continuation of the external iliac, as you see, but just the name changes to the femoral artery. Here is the external iliac above the inguinal ligament. Here is the femoral artery below, just below to the inguinal ligament. Femoral artery, you see here is the femoral triangle. If I put this arterius back to its place, we can find the femoral artery into this femoral triangle. Then it passes underneath the sartorius and goes down through this subsartorial canal or adductor canal, and then it passes through the adductor hiatus and it goes back to the knee. Then after passing the adductor hiatus, its name changes. If I take the gluteus maximus away and hamstring muscles is also away, you can see here is the adductor hiatus. It is made up of by the Adductor Magnus. So here is the femoral artery. When it passes through the adductor hiatus, its name changes to the popliteal artery. Here is the popliteal fossa, so it is popliteal artery. So popliteal artery is the continuation of the femoral artery, just its name changes to the popliteal artery, and it crosses the knee joint and passes down. And when I remove the superficial layer of the posterior compartment of the leg, you can see popliteal artery very well. So here is the popliteus muscle. When it crosses the inferior border of the popliteal muscles, it divides into the divisions you see here. It gives up two divisions. Here is the posterior tibial artery. Here is the anterior tibial artery. So anterior tibial artery piercing the interosseous membrane between fibula and tibia and passes forward, which is called anterior tibial artery. So here is the anterior tibial artery, here is the posterior tibial artery. And posterior tibial artery gives off a branch to the lateral compartment, which is called fibular artery. Then posterior tibial artery goes down and passes through this tunnel, which is called Tarsal Tunnel, and then crosses the foot, sole of the foot. I will show you here. Okay, here is the posterior tibial artery, passes deep to the flexor retinaculum, and after passing to the flexor retinaculum, it divides into two divisions. You see here is the medial plantar artery and lateral plantar artery. You can see medial and lateral. Here's the medial side, the big toe. Here's the lateral side, lateral plantar artery. They supply blood for the muscles of the plantar surface of the foot. I will show you again the branches. Here's the femoral artery. Femoral artery gives off an important branch which is called deep femoral or profunda femoris. Can you see? I will take the rectus femoris away and you can see easily. Here is the femoral artery. Here is the deep femoral artery or profunda femoris. Profunda femoris supplies blood to muscles of the thigh. So you see some branches coming off from the profunda femoris. This branch is called lateral circumflex. Here is the lateral circumflex. It gives off some branches. It also gives off medial circumflex. I will show you in this model. Here is the femoral artery. Here is the profunda femoris. It gives off lateral circumflex and medial circumflex. Medial circumflex is important because it supplies blood to the head. You see it comes back and blood supply gives off blood supply to the head and neck. The important thing here is that here is the femoral artery, and then he goes here. Here is the femoral artery. After passing the adductor hiatus, its name changes to the popliteal artery. Popliteal artery gives off some branches around the knee joint and make anastomosis. These branches are called geniculate branches. So we have geniculate anastomosis around the knee, superior, inferior, genicular branch, superior medial lateral, inferior medial lateral, genicular branch provides anastomosis around the knee joint. Here you can see. And yeah, in this picture you can see very well. Here is the abdominal aorta. It divides into two branches. It gives off internal. Here is the common iliac. Two branches, internal and external. External, after passing through the underneath the inguinal ligament, its name changes to femoral. Here is the femoral, and one branch is coming off from the femoral, which is called Profunda Femoris. You see here is the lateral circumflex branch of the Profunda Femoris, and here is the medial circumflex branches, goes back and it provides blood to the neck and head of the femur. And you see Profunda Femoris gives off some perforating branches, first, second, third, and fourth perforating branches of the Profunda Femoris. They are wrapping around the shaft of the femur posteriorly, perforating branches. And then its name changes to the popliteal after passing the adductor hiatus. Its name changes to popliteal, and popliteal gives off genicular branch, superior and inferior genicular branch. They make anastomosis around the knee joints. So, and as I mentioned, here is the popliteal artery. In the inferior border of the popliteus, it gives off two branches, anterior tibial and posterior tibial. Anterior tibial goes forward and provide blood supply to anterior compartment muscles. Here is the fibula, here is the tibia, and this white connective tissue is interosseous membrane. So anterior tibial artery passes forward at the top of the interosseous membrane, and it goes down deep to the anterior compartment muscles of the leg and provide blood supply to these muscles. And then if you look at here precisely, after crossing the ankle joints, anterior tibial artery's name changes to the dorsalis pedis. It's not visible in the anatomy model, but here you can see. Here is the anterior tibial artery. When it crosses the ankle joint, after passing through this ankle joint, its name changes to the dorsalis pedis because it crosses the dorsal surface of the foot. It is dorsalis pedis. And it gives off an arcuate artery. Here is the arcuate artery, and it goes down and links to the arch here. Here is the posterior tibial artery. After passing underneath the flexor retinaculum, it gives off two branches, medial plantar and lateral plantar. And you see here, I will show you, medial plantar provides a plantar arch artery. Plantar arch artery links or anastomoses with the dorsalis pedis here. They links together between first and second metatarsal artery. Thank you.